the Vice President at Large of Mid-South Churches Cooperative Conference Baptist State Convention, Pastor Bernard Montgomery. Pastor Montgomery.
Amen. Certainly, I want to say good morning to everyone. We are very much appreciative to God for this opportunity that we've been trying to do for the last several years, and we are grateful that we have an opportunity to share across the breadth of Mississippi in the Affordable Care Act. God has graciously been kind to us and provided us with this opportunity to assist his people. And we are Mid-South Cooperative Conference. And what that really means is that we have an opportunity to be blessed to be able to share in our convention into 3 states, Mississippi, Tennessee, and Arkansas. Amen. So we have churches from all those various areas. Description of the Mid-South churches and organizations focused on Christian education, health and wellness, promotion, and economic empowerment, covering the lower Mississippi River Delta counties in North Mississippi, Eastern Arkansas, and West. Mid-South Cooperative Conference must successfully support an effort in our health ambassador training and the Department of a statewide health ambassador network, heading by our executive board, a vice president, president at large, and 4 vice president. Mid-South Churches is an organization around 4 regions. So we're thankful to God for those regions, although the regime. They are the Mississippi Faith-Based Health and Wellness Network and a numerical group of faith organizations. The Mississippi Primary Care Association, representing the state's community health centers, wellness initiative of houses of worship to Yazoo City of our leadership. Certainly, we thank Dr. Michael O'Miner as our president, Pastor Bernard Montgomery, yours truly, Vice President at large, Sister Christine Albright, our General Secretary, and Sister Loretta Miller as the State Director of Christian Education. Sister Maddie Wallace Stokes is our State Dean. Certainly, God has provided this opportunity again for us. So let me give you a brief description of the community application expected to serve. Although Mid-South Churches has connected across the state, especially emphasis will be given to the Mississippi Delta and rural Southwest Mississippi. Mid-South Churches will focus its effort in the state of Mississippi and special emphasis again on the Delta of Mississippi and rural Southwest Mississippi, because Mississippi and the Mid-South Churches is representing the state convention in the North and the National Baptist Convention, U.S. Incorporated. Our effect state one of the poorest state in the or Let me say that again. Mississippi.
We apologize for technical difficulties. We apologize for technical difficulties. All right, so Pastor Montgomery just resume and he'll complete the previous thing that he said. Continue on, Pastor Montgomery.
Again, Mississippi has 511,758 uninsured, with 110,984 in the Delta and 56,683 in Southwest Mississippi. Mississippi is in the top 10 national for the percentage of insured. Since we've launched a CMS insured program, Affordable Care Act, or the ACA, Obamacare, our efforts in March, this funding opportunities comes at an opportune time for Mid-South churches. The Mississippi Health Policy Research Center at Mississippi State provides the following snapshot of the uninsured in Mississippi. Poverty. Poor people are significantly more likely to be uninsured than wealthier people. Poor is defined as received income below the federal poverty level. The near poor has income between 1 and 2. The FPL, I'm sorry. The non-poor has income of 2, at least 2, or more than the FPL. Among Mississippians, over 29.4% of the poor were uninsured. We were 24.9% of the near poor. Only 12% of the non-poor were uninsured. However, because the non-poor makes up a large portion of Mississippi population, they represent 44.7% of the uninsured. Race. There is a strong association between race and insurance. While Mississippi will serve primarily these communities, the Mississippi Delta and the Southwest Mississippi are naturally fit for the effort of Mid-South churches. Let me say that again. The Mississippi Delta and the Southwest Mississippi are naturally fit for the efforts of Mid-South churches. First, we will already have a presence in these communities directly or indirectly through our health ambassador training and health ambassador network. Our ongoing outreach efforts focus on CMS, insurance programs, and the ACA is already active in these areas. Secondly, it has been our desire to connect our efforts across the state, starting with the Delta. These focal communities are in keeping with the desire. Finally, these communities have some of the highest numbers of uninsured in the state. Additionally, through its direct and indirect network of houses of worship, which is important, our churches will be an integral part of what we're trying to do. And we're thankful for the pastors and the churches that already participate. And we look again across these 3 states, especially again in the Delta, Mississippi, to expand and bring in the Affordable Care Act and share. This is a great day. This is November the 1st. Again, although the state of Mississippi will lead the way, but certainly with our partnership across these other 2 states, we will be welcome to be able to bring this activity and these programs to this state. Additionally, Mississippi will mobilize houses of worship to be boots on the ground in these hard to reach areas with a face-to-face outreach approach. As a trusted voice in these communities, we firmly believe that the uniquely positioned of Mid-South Cooperative Conference to serve these communities. Moreover, through training described below, an unlimited number of health ambassadors will be promoting ACA in their churches and the communities they serve. Let me give you some numbers for the state of Mississippi and the Delta. The number of people Mid-South churches expect to serve, percentage of the state uninsured population, the expected community account for through these efforts, Mid-South churches expect to serve about 200,000 people. Let me give that number again. Mid-South churches expect to serve about 200,000 people. The Mississippi Delta represent about 22% of the state uninsured population. Rural Mississippi, Southwest Mississippi, about 11%, totaling about 33% of the state's scope of activity. Mid-South churches plan for carrying out the requirements and cooperation agreement is based on its ongoing health ambassador training and network. Since 2009, this training curriculum has been used to train ladies and laymen and some clergy in becoming health ambassadors. Today, Mid-South Churches has been successful in gathering, gaining, training health ambassadors in faith associated representing nearly a third of Mississippi, 82 counties. Now, what we have here is need health insurance. Here are the 5 facts you need to know. Number 1, open enrollment on the healthcare market begins on November the 1st. Let's see. Today is November the 1st, yeah. And lasting until December the 15th. That's about 6 weeks.
You know what? They expanded it now.
They expanded it.
It goes January 15th now.
Wow, January the 15th. Boy, that gives us almost another 2 weeks or more.
Yeah.
Oh, on the healthcare.gov, best beat the rush and sign up early. No matter, number 2, no matter if this is your first time getting covered or you are returning to shop and serve, you must take action by December the 15th.
January 15th now.
January the 15th now.
Yeah.
Oh,
Everybody's thinking it's the same old. Well, yes, under the American Rescue Plan, it's now January 15th.
wow, great. Number 3, coverage could be more affordable than you think, and there is a possibility to receive financial help.
That's correct.
Wow, okay. Last year, 8 in 10 people qualified for financial help. For most people, that meant they could find premium between $50 and $100 per month for a plan. Wow. Number 4, plan through healthcare.gov covered. 10 essential benefits. So how important is all those 10 essential benefits? 10 essential benefits, including behavior, care, and prescription and drugs. Number 5, free help is available. You mean it costs nothing to get some help? If you have questions about signing up or want to talk through these are your options. With a trained professional, free help is just a call or click away. Call 1-800-318-2596 or go to www.healthcare.gov nationally, 662-298-3585 or www.getcoveredmississippi.org for the state of Mississippi. Hernando, our regional community development corporation, right here at 1775 Memphis Street in Hernando, Mississippi. So there's plenty of opportunities and plenty of ways that you can get in touch with us or find some way to get this new information. Want to share what Mid-South Churches is also doing. Mid-South Churches launch the Enhanced Health Ambassador Training class in March. Certainly, we continue with the healthcare. So what else can we find to do with this great opportunity to share when it comes to health? We're gonna get ready for Sister Lorella Miller to come in, and she's gonna do the educational component of what Mid-South Churches does. And as she prepares, again, make sure that if someone tells you that is the Affordable Care Act, ask for those 10 essential benefits and ask them, are they a part of the marketplace? There are a lot of insurance that are credible, but there are some that are not. So make sure just because individuals say that they're using or have an opportunity for you to sign up in the Affordable Care Act, make sure that they're from the marketplace. Again, continue to get good information from my website or either continue to call here at our headquarters location. At this time, we're going to bring Sister Loretta Miller up so she can give us some of these educational points for Mid-South churches.
Good morning, good morning, good morning, or good afternoon. It is now November 1st, and it is open enrollment for the Affordable Care Act. I do want to talk about the 10 essential benefits, but first I want to talk about the Affordable Care Act. And as you know, this is open enrollment number 9. We have transitioned in our healthcare to some major things, and it's vitally important that we have the Affordable Care Act. I just want to talk about one thing in specific that the Affordable Care Act does for me. It is called pre-existing conditions. As a kidney cancer survivor, I live with one kidney. And with living with one kidney, there are a number of doctor visits that I take or that I must have. And so if the Affordable Care Act was not in place, I would not be able to have insurance because of the pre-existing condition. It wasn't that I'm just a bad person, but it's just unfair to limit someone's health care based on their pre-existing conditions. Now, suppose you had breast cancer, or suppose you had diabetes, or suppose you had a heart condition, or maybe there were other physical conditions that you had no control over, maybe even generational curses. If you had some of those things going on, then you wouldn't be able to be covered either. But with the Affordable Care Act, with the Affordable Care Act that was signed years ago, that we so often call Obamacare, we're able now to be insured. That limits our out-of-pocket expenses. That limits us with our sicknesses, because as long as we maintain our doctor's visits, and as long as we maintain our health, and as long as you be around somebody like Dr. Minder who doesn't eat fried chicken, then you'll be healthy, or you'll be able to take care of yourself and be able to have insurance. And so with the pre-existing conditions and the Affordable Care, yes, you are allowed to have pre-existing conditions and insurance. Okay, now tobacco is not a pre-existing condition. So tobacco cessation is something that we need to deal with as well. Okay, so I'm going to talk about the 10 essential benefits of the Affordable Care Act. Number 1 is ambulatory patient services. So you can get outpatient service without being admitted to the hospital. Suppose there was a minor test you wanted to do, and your doctor wanted to perform some minor surgery, maybe on your breast. That's covered in the Affordable Care Act. Okay, emergency services include, which means using the marketplace coverage to get emergency care. We don't know when we're going to get sick, but that is the reason we have insurance. We have assurance with being saved and being a Christian and being a part of the body of baptized believers. But we have insurance, which is offered through the Affordable Care. And that's just number 2 of the 10 essential benefits. Now, these benefits, remember, are open to all persons that have the Affordable Care. So just go to the marketplace, call someone, and we'll get you some insurance. Number 3, hospitalization, that's covered. Surgery and overnight stays, those are covered. There are 4 types of plans with the Affordable Care Act. You can be covered under the bronze plan. You might choose the silver plan. You might choose the gold plan, or even the platinum plan, but it's all based on your choice. The Affordable Care Act does allow for advanced premium tax credits as well to help you with your premiums. So remember that when you're looking for your assurance doing affordable care. Okay, number 4, and I don't know if this is racist or not, but pregnancy, maternity, and newborn care, that's covered. Okay, both after term, before and after term. Okay, so the woman might be the only one that carries the baby, but there's also leave that you can take for the husband to assist with the newborn. But that's covered under the 10 essential benefits. That's just one of the 10 essential benefits. That's number 4 that we're going to talk about. Okay, I think Pastor Montgomery talked about this briefly. Mental health and substance use disorder services, that's covered. PSTD, that's covered. Those types of things for behavioral treatment, that's covered. This includes counseling and psychotherapy. And it's not anything wrong with getting some additional help when you need it. We all go through different times in our life, maybe through this pandemic. It is extremely important that we're well, body, soul, and mind. Now, it's okay to ask for assistance, and don't be afraid to ask for assistance and to use your affordable care insurance. Okay, we all need insurance. ACT, Affordable Care. Okay, so we'll go on to talking about number 5, and we'll talk about, continue to talk about this counseling and psychotherapy. Okay, so I have the cameraman in the background talking to me, so please forgive me. But some other things that go through with dealing with our mental health, not just the pandemic, but it's just has been extremely stressful in this situation. So if you just need some assistance, if you need someone to talk to, maybe grief counseling, whatever you need, that's covered with the affordable care. Okay, that's number 5. Now, number 6. Number 6 is prescription drugs. So I know we talk about drugs that are covered, okay? So the Affordable Care Act covers prescription drugs, okay? So like I have certain drugs that I need to take because of my pre-existing conditions. Well, those are covered under the 10 essential benefits. Okay, that's number 6. Number 7, rehabilitative and rehabilitative services and devices. Those are covered. Okay, any kind of devices or services that you might need to help with your injuries, to help with your disabilities or chronic conditions, or even to help you to regain the mental and physical skills that you might be challenged with. Those are covered under the essential benefits, 10 essential benefits. And just so you know, every plan that is a part of healthcare.gov, every plan when you go on has all of these 10 essential benefits. Okay. Number 8 is laboratory services. Those are covered under the 10 essential benefits. So if you have to have lab work done, which we so often do, just remember that's covered as well. So don't be afraid of words like premium or preventive healthcare, because all of this is covered under your 10 essential benefits. So there are not additional expenses, they're covered, and these must be offered as a part of the Affordable Care Act. Number 9, we're going to talk about is preventive and wellness services, which means that you're covered, okay? Preventive care. Say you want to join, your A1C is now at 5859, and your doctor says, we want to do some things to keep you from getting to 6.0. Well, your doctor might recommend some preventive things to do or some disease management. Those are covered. And that's a part of making us healthy. There is something that started out when we started with the Affordable Care Act. There was a discrepancy between the people that were able to afford insurance and people that were not able to afford insurance. And with the Affordable Care Act, we're all able to afford insurance. And that's just another good thing about this program. It's November 1st. It is time for signups, and we want you to join us. Last but certainly is not the last thing that's covered, but is number 10 on the on the 10 essential benefits is pediatric services, including oral and vision care, but not for adults. It's not covered. Adult dental and adult vision is not covered, but it is covered for children. So these 10 essential benefits, we really want to make sure. One of the things with our children is to maintain that they have a good oral regimen. We want to make sure that they brush their teeth. We want to make sure that they're taking care of their teeth. We want to make sure that their eyes are taken care of. We want to make sure that they get their normal yearly eye exams, because we want our children to grow up healthy. And number 10 of the 10 essential benefits is oral and vision care. Okay, so that's the 10 essential benefits that are covered. If you need additional information, you can call our headquarters number at 662-298-3584. Again, that's 662-298-3584. Correct?
Thank you, Sister Loretta. All right, so we're gonna bring Sister Heather Hill up firstly. Sister Hill, get to the spotlight. Sister Heather Hill, and she just adjust her camera. She is down in the Cleveland, Mississippi area. She's part of our Mid-South Churches team. Sister Hill. All right, Sister Hill, are you able to join us here?
Yeah, John.
Unmute yourself, Sister Hill. There you go, Sister Hill. Go ahead.
Now. Okay, now I'm unmuted.
Okay.
Mhm.
All right. So, Sister Hill, can you tell us what encourage the folks down in your area, where down in the Cleveland area? What do you want them to do, Sister Hill?
Well, I kind of did something yesterday, and I had kind of a question. We had our General Missionary Baptist Bolivar County Association, and on the back of my program, I follow with Healthy Kids. I got to add the part on there. I've got to add my navigator part on there, but somebody did speak about that. But that was good yesterday. But today, I'm hoping that a little bit later on, I will do my first client for the Affordable Act for November the 1st.
Affordable Care Act. All right. Sister Hill's gonna be the first one. All right.
Right.
Right here, hold up. November 1st. She's gonna have her first.
November.
Today.
Today.
Hey, look at that, everybody. She's got it. The first one. All right, go ahead. There you go.
Mhm.
All right.
Y'all wish me luck now. Pray for me while I
Now,
go
you
through
got-
this now.
For those down in Cleveland and
Yeah.
Pace,
Pace.
Cleveland, all down in that area down in there, Bolivar County,
Yeah,
you got them covered? Clarksdale, maybe?
maybe. Yes, I got them covered. Right.
All right, so Sister Hill, what's your phone number? Because they want to call you down there.
662
Uh-huh.
721-3791.
What's the number again now?
662-721-3791.
All right, thank you, Sister Hill, for joining us today. Thank you.
Thank you.
All right. We're excited about what she's doing. Sister Hill, all right,
All right.
thank you. All right, let's we keep things going. I guess you saw me earlier this morning. You see me again. All right, so we got a few other questions that popped up. I'm glad to be here with you. And I am the president of Mid-South Church Cooperative Conference, Michael Minor. And we're glad that you are here with us during this time. Pastor Montgomery, our Vice President Live, we thank you for joining us earlier. We wanted Sister Loretta to share with you about those 10 essential benefits. Look, folks, it's not just enough for you to go ahead and sign up. We want you to be users. So we want you to get covered, then want you to stay covered. A lot of people think that this is not great insurance. It is. All it is private insurance through a federal marketplace. We want to encourage you all, every church is represented in this area, every pastor, every deacon, every trustee, every mother, every deaconess. We want you to tell folks about this Affordable Care Act. Look, let me let y'all know something. Under the American Rescue Plan for the Biden administration, we now have some of the lowest premiums that we've ever seen. Folks who didn't qualify before are qualifying now. Look, if you applied in the past and you got a premium that you weren't able to afford, don't give up. Try now. Look, we got navigators. Matter of fact, we got a navigator right here beside you right now, Sister Kathy Garrett, who is ready and willing to assist you. Sister Garrett, who's part of our Sister Garrett, come on, Sister Garrett, who's part of our team. One of our new members of our team, part of Mid-South Churches. And Sister Garrett is ready. Sister Garrett, are you ready to be able to assist some folks here and get some things done, Sister Garrett?
Yes, I am.
All right. And then so Sister Garrett is going to be working hard down at Panola County, Lafayette County, our family and friends. And Sister Garrett, I heard you know everybody. Everybody knows you down there.
I know a lot of people, yeah.
All right. All right. And you ready to help them, Sister Garrett?
I'm ready to help them. If they need help.
Yeah, so call here 662-298-3584. Y'all know Sister Kathy Garrett, some young down in there. If you don't, you need to get to know her. She's one of the nice people I know. She wants to help you get enrolled with this Affordable Care. Is that right, Sister Garrett?
That's right.
All right, thank you, Sister Garrett. She's ready to come on. She's one of our navigators up here. She just came in and joined us, part of our Mid-South Churches team. She's our Assistant General Secretary. She wants you to sign up and get excited about what we're doing. Look, y'all, it is time. It's November 1st. Open enrollment has started. We want you to be a part of it. Look, the churches, man, pastors, deacons, trustees, missionaries, evangelists, all you all. We want you to come and be a part of this effort. We want you to get excited like we are and sign up for it. Look, we got some questions coming in. Again, all right, look, there's no charge for our service. People keep asking that. No. Our navigators, our certified application counselors with community health centers, there's no charge for our services. Mid-South Churches.
You said there's no charge for our service.
No charge, man.
All the time that you put in, and there's no charge.
No charge. Even sometimes it take 3 or 4 hours to go back and forth. No charge.
Well, what if I ask the same thing 10 times?
Then it's still no charge. You got 12.
And if I bring somebody with me and they want, there's still no charge?
Still no charge.
Wow.
The government, we have a grant from the federal government that pays us. And once that grant pays us, and so we don't have to worry. You don't have to worry about coming and paying anything for us. We want you to come out and be a part of it. And so look, we're gonna bring our team, Pastor Montgomery come on up here. He's our vice president at large. We're gonna kind of answer some more questions that we got right here and things that we're doing that's coming up. We give my phone up and we're gonna try to answer many questions that we have. Oh man, somebody asked us back behind here for what our this. So this is our, people asked about this. This is not necessarily part of our Affordable Care Act, but this is the vision for. This is our vision for our convention.
Okay.
Right. So yeah, our vision for our convention for 2020 to 2026 each year is one of our things. So we had voice this year and its integrity, and it's based on Vision 2020 that Mid-South Churches wants to be not only a state convention, but a cooperative conference that goes out and makes the community better. That's what we want to do. Make the community better. Do some things, find resources. It's funny. Pastor Montgomery, when we started, when we started the Mid-South Churches part, 2002, it was just a cooperative conference.
That's correct. But Dr. Martin, I'm still puzzled about something.
All right.
Now, if I come in to Sister Gary, she's a navigator assisting me.
Mhm.
Can I bring someone if I don't quite understand some of the information that I'm being received to assist me with it?
Yes, you may. You may come in, call us anytime, set an appointment, because we're still in the pandemic environment. We're still masking up. I'm in, it may be curbside service. We may have to have our little plexiglass screen up. Well, we're going to work with you in a safe environment to make sure that you're covered. I would just call 662-298-3584. 662-298-3584. Give us a call. We can get set up for you.
Well, I got another question for you.
Mhm.
I'm married. I got 2 kids. My neighbor's married. They have 2 kids. Do we have the same opportunity with the same benefits?
Everybody has the same opportunity for the same benefits. It doesn't discriminate based upon your house size, household size, whatever. Come in and apply. If you're in the state of Mississippi, we want to be able to assist you. And we will still, as Mid-South Churches, as a faith-based arm, we're challenging pastors, we're challenging evangelists, ministers, deacons, trustees, the mothers, the deaconess, the choir members, the ushers, the health ministries, to get involved and be a part of 662-298-3584. 662-298-3584. We can assist you today. Look, I got another question that pops up here. And, there's still some people who are, okay, we might address this. There's some people who still say this is terrible. This Obamacare, look. And it's just a socialist. Let me tell you something, folks. Medicare is a government program.
Yes, it is.
And everybody's trying to get to 65 to get the Medicare. That's a government program.
Yes.
Okay. Now the ACA is actually not a government program. It's a government marketplace, but your insurance is private.
Right.
It's just health insurance like you get a job. But, we got 3 health insurance companies.
3 this time?
Yeah, you got Cigna, Molina, and Ambetta. So it's that. So it's not something that's trying to twist you off. And look, you made me think about something, Pastor Montgomery. We had a gentleman that wanted to start his business. I think it was a lawn care. And he needed his wife. I can't remember the type of business. He needed his wife. He was making $100,000 a year. And his wife was his bookkeeper and do all that. But she had to work, or I don't know if it was him or anyway, they had to work part-time to keep the health insurance up. They came in and they were skeptical. They didn't like it. They heard the things on the news. They heard about this Obamacare. And once I explained to them that it is just private insurance on federal exchange, they ended up enrolling. And what ended up happening, once she enrolled, they were able to have more time to grow their business. The last I checked, they were on there. We're probably making over $1 million now. But the key thing was with the Affordable Care Act, and they weren't worried about the subsidy. They didn't need some. Man was making plenty of money. He didn't care what the amount of the premium was.
He just wanted insurance.
He just wanted insurance. And once we explained to him it wasn't a federal program, it was just good old private insurance. They got it. He's growing his business now. And I imagine now it's a multi-million-dollar business. But it couldn't grow because they had to keep working part-time on their job to keep the insurance. So I want people to think, I know we keep emphasizing the subsidies and everybody get zero premium, but we got a lot of entrepreneurs, especially up here. We're in North Mississippi, DeSoto County, one of the richest counties in the state. We got a lot of entrepreneurs, a lot of people who are trying to step out in this pandemic and they need insurance. They are signing up for this. They're not worried about the premiums because they're trying to make the American dream. They're starting their businesses, they're making money, they're hiring people, they're paying taxes. That's a wonderful thing.
So you're saying there's 2 things. There's a lack of information and then there's bad information.
Right, lack of information and misinformation. And again, that's why we want the churches. And I challenge Pastor Montgomery. I know a lot of pastors, a lot of people around and whatnot. We try to get down. We got a big meeting, and we try to do things in a physical distancing, but social closeness down in a sledge, and we're trying to make that down on Sunday, and what are some other things we got going. But the idea, folks, is it is good insurance. And Pastor Montgomery, he's blessed because he's a veteran. I don't have to worry about that. But Pastor Montgomery, if you weren't a veteran and you had time to retire from the post office, really, you'd be a perfect candidate.
Absolutely.
Because you got some six in your age. But anyway,
At least one.
yeah. So he's able to enjoy his family now and still have to walk that beat with the post office. Now he's a veteran. I know somebody says he's a veteran, but if he were not a veteran, he would have had to stay on longer or get a part-time job. But he'd be a perfect candidate to come and get the insurance, the health insurance. Then also Pastor Montgomery, remember the pastor, I think was up at some CME conference. I think it was in South Haven. And he wanted to go full-time ministry.
Yes.
And we talked, and he really didn't think it was gonna work.
No, he thought it'd be too expensive.
Yes. And so I don't remember, I think maybe Sister Jefferson, I don't know who he worked with, but he worked with him, and it ended up being affordable, and the church ended up paying for the premiums. And the last I heard, he was able. Now I know that they have some for the CMEs and all of them. They got some things they do to help, with their pastors and their pastors' salaries and things. But he wanted to work and do some other things, beyond that. But having this insurance allowed him some flexibility he otherwise would not have been. Okay, because I saw that frowny face and the people coming up in here. And look, if you would read, that's why I'm glad.
If I would do what?
If you read,
Okay, gotcha.
the information they have about it. That's why I want Sister Loretta to talk about the 10 essential benefits. But if you look at it, we got all kinds of people. Now look, Pastor Montgomery, since we brought that up, one of the first people we enrolled was the first couple came from Panola County. And the couple came and drove up because they really didn't want anybody else to know that they were enrolling. They hadn't heard anything about it. They weren't unsure about it. They drove up, we talked to them, we walked them down to it, and they were just like, wow, because they didn't know it was just insurance, like on the job. I think the thing he was talking about was like, this is like open enrollment at my job. Yes, it's like open enrollment on your job. You just go in, you put the stuff in there, get your plan, and there you go. This is not. Now, if you want a government program, wait till you turn 65, you get on Medicare. Some of y'all gonna be like me, be 68, whatever the case may be. That is a federal program. The Affordable Care Act is private insurance. Private insurance, and it is on a federal exchange marketplace.
How many plans on them?
Well, we got three insurers now. They got different plans they go on to see the bronze plan, the silver plan, for most things that I have and available, and look at it and make sure you follow through.
Well, Dr. Monty, you said something about privacy.
Mhm.
What would you do with my information? I mean, I got a couple loans that I hadn't paid. So what would you do with my information?
And I'm still looking for people who may are having some questions. Now, the thing about it is we need that information. When we get a consent form from you, either we're going to do that virtually or we'll do that in person to get those things done. Because once we get your consent, we're going to go over the information for your income and your household information so we can make a determination about your whether you qualify or not. And then once we get through doing that, you can also give us permission to contact you throughout the year so that we can provide you updates about some different things going on about health, or you just say, I'll see you next year. We have some people that come back, they know us, they come back every year and we set them up and we take care of them on the ACA.
Okay, well, one other question. What type of ID do I need to bring with me?
Well, actually, when you come through, they're gonna do some they call it identification testing.
Okay.
So you go in and you go through the process. They're gonna ask you some questions from your credit report, like where you used to live back in whatever. And
We don't answer those.
no, we don't. Right, the application, right? We don't ask the application. They're gonna have it there, and on that process. And when you go through it, you'll see it through the healthcare.gov, and healthcare.gov is going to check it out and see who you are. It's not some alien or something that's in there. Whatnot. So
Well, one other question now. I'm not real computer savvy. How
we
does that
we
go?
know.
So how are you gonna assist me?
You told the truth. Well, we have some people that have issues with it, so we come in and work with them, and set their account and whatnot and everything. So even if you're not computer savvy, you never had an email account, we'll work with you.
Well, what with this username and password? What is that about?
Everybody needs to have the username, be the email address, their separate account in healthcare.gov. Got your own password, your password questions you ask. We'll get the information, work with you. You'll have it. You come back again next year. Some people come back to the little information we gave them. So here's, ready to log in. They go in. We help them get them set up.
So you're saying that once you give me my username, my password, I should keep up with that as well.
Yeah, you should keep it with that like you keep up with everything else, so you can have it back and be ready to rock and roll. We get ready for an open enrollment 10 on next year.
What about security questions? If I forget, how do we handle
We got
that?
the security questions on that you pick out yourself, some things that you know, so you can help to reset your password if you forget it. Okay.
Wow.
662-298-3584. 662-298-3584. Pastors, preachers, come on. We know them, Pastor Montgomery, deacons, trustees, choir members, ushers. We want everybody to know. We want you to come in and whatnot. And look, and again, people are asking about this is our theme here, the thing we're trying to do over the next 7 years with Mid-South churches. We want to take a look. We know that we are in a pandemic. One of the reasons why we're excited to be involved in this is that we want to make sure that we're connected with our community. We want to be a voice for the voiceless. We want to show integrity, that people know that we at the church, we are concerned about them as individuals. We want to have, of course, we are a faith-based group. We're always concerned about soul salvation, instruction, not only in the biblical word, but also how to do things in the community. All kinds of opportunities available. We want to work with our churches to make sure they have obey. And of course, I like the last one here. We want to be neighboring.
Okay.
We want to be able to do things to work with folks all across the state of Mississippi. Now look, Pastor Montgomery talked about our footprint is really North Mississippi, the Mississippi Delta, rural West Tennessee, Eastern Arkansas. But with our cooperative conference part, we have connections all across the state of Mississippi. That's why Sister Hill was on. Whatever she's down there working on. We're working down in Macomb, Mississippi, got folks down there, over in Meridian, all across the state of Mississippi. Because of our cooperative conference part of what we do, we can assist you. 662-298-3584. We're right here in our headquarters. Here's the headquarters, 1775 Memphis Street, Suite A here. Come in, we're able to come in and do some things and make things happen. And whatnot. And everything. All right. Pastor Bernard Montgomery, he's our vice president at large. I'm the president. We also, Pastor Reuben Jones is our first vice president. He's out there in Coldwater. We have Pastor Callaway Bain, the pastor of the new Mount Olive Church in Horn Lake. Pastor Glenn Newsom there at Greater Lake Carmel in Lake Carmel. And Pastor Lacey Reed down at Mount Olive Sledge. And we're praying for Pastor Reed. He's been living on the weather and whatnot. But Pastor Reed, I want y'all to know something. Pastor Reed, I talked to him this morning. He has been under the weather. He's been healed. He's been in the hospital. You know, Pastor Montgomery, they have a benefit for him Sunday. And he wanted us to come down and talk. I thought he wanted us to talk about, the convention. He said, look, open enrollment started. I was like, what? Here he is, a man sick now. Been in the hospital. And he wants open enrollment. Look, I need y'all to talk about, it was ICU. I need y'all to talk about the affordable Obamacare down this Sunday. The folks need to hear. Now look, y'all, Here's a man that's been sick, been in the ICU in the last couple of weeks, and they have a benefit for him. And he wants us to come down there Sunday and all these churches and pastors and talk about the Affordable Care Act. That's how much it means to him. Now look, y'all. He's got that kind of passion. He wants you to inquire. He wants you to call 662-298-3584 and get more information. He wants you to get covered Mississippi. Okay. Yes, we can go to churches and the question, can we go? Yes, we'll go, as long as we're still doing what? Our physical distance, but our social closeness. We'll be physically distant, but we'll be socially close. And we can Zoom you.
Yeah. You know, Dr. Minor,
Uh-huh.
I see Mid-South Church of Cooperative Conference.
All right.
And as a pastor, I understand how important salvation is.
Uh-huh.
But at the same time, with Affordable Care, how do we separate those two? You just come in and I don't have to tell you what church I'm from, no denomination or anything like that?
No, we don't proselytize because it's a federal grant, even when the federal grant. If you want to come in and get assistance, our number one thing is to help you because we want you to be whole, mind, body, and spirit. And one of the things we can do is on the health insurance. So we're not gonna come in and have Bibles and beat you over the head, try to proselytize you. We want to work with you. Now, if you come and once we finish that part and there's a need for you on the spiritual side, by all means, we're able to do so. But Mid-South Churches, Cooperative Conference, Baptist State Convention, we're committed as a part of this grant to sister churches, to sister associations, and other groups to make sure that we can do what we need to do to assist you to get signed up for the ACA. Come on, Pastor McGovern. What's that number again? 662-298-3584. 3584. We were changing the number. We know that number.
84?
Right, 662-298-3584. All right, yeah, get the number. Write that down. HMO. Well, actually, from my understanding now, on the new coverage, Molina and Better and Cigna will just have standard plans and not necessarily have an HMO this go around. That's my understanding.
What's the deductible?
Now,
The deductible is based on the premium that you pay. Your deductible will come, not necessarily, you got a premium, then your deductible. And you have to meet your deductible based on your premium before actually the insurance tries to pay.
What's my premium?
Your premium will be the monthly amount that you will be paying for the plan that you select.
I have a question.
yes.
What, if I was talking to somebody Sunday,
Mhm.
what if they have a high income and they feel like they wouldn't qualify, but they no longer work, they're over 65, him and his wife,
Almost 65.
yeah, and they pay for health care now. I think they may be covered under something, but they pay a lot out of pocket.
Well, now, the 65, he's over 65, when we put an ACA, it'll be Medicare. This way is of having a lot of taxes to Gary. With a lot of people with 65 that's a husband, the wife's not covered because she's not 65 yet. And that's we call it mixed income, mixed household. So he ends up having two things. This is a Medicare, and I know we're doing an Affordable Care Act. For the husband, he's got to look at those advantage plans for this open enrollment now, October 15th through December 7th. And so we got a plan, I know, something that have. And then for the wife, she's probably not going to be at 65. She'll look at the ACA, and then maybe an opportunity for her to enroll. Remember, everybody quote unquote qualifies for the ACA. It's applied. The thing is the subsidies, the advanced premium tax credit, because you're not going to be denied. You just not maybe able to afford it. You won't be denied. Nobody's denied for coverage. You just may not be able to afford it because you don't qualify for advanced premium tax credit. But what Sister Garrett says happens a whole lot. We get a whole lot of questions. And look, I know it's time for us to wrap up because we know we're going to be wrapping this up now. And we're getting ready for our 3 o'clock session. We was at 9, but 662-298-3584, Mid-South Churches. We are here, and on next year we will be. So in 1938 we started our Christian education part of us down in Mississippi Delta. In 2002, we became a cooperative conference and got our website going. In 2012, we became a state convention recognized by the National Baptist Convention, USA Incorporated. Next year, we'll be celebrating 10 years of state convention, and we'll be celebrating 20 years as a cooperative conference. So we are excited about what the work that we're doing. Come on, y'all. Pastors, call us. Y'all know us. A lot of y'all know Minor M's, Minor, Montgomery, the other M's, Miller. Come on. We want y'all there. Yeah, you want y'all to get signed up, contact us. Now look, all the folks that putting frowns and stuff on our Facebook page and stuff, you call us and contact, we'll talk to you. You know, look, I didn't care for Sister Maya when I first met her. I didn't like her. All right, but once I got to talk to her and whatnot, I fell in love with her. I didn't know until I started talking to her. Okay, so all you folks up here that's frowning and say something wrong with it, you don't know what it is until you talk to us. You may find out something that can work for you. All right. And I've been married to Sister Maya now 26 years. So you just never know how that's gonna work out and gonna do it. But contact us 662-298-3584. We want to work with you.
Real quick, what about people with really low income? You talked about the really high income. What about really low?
FQCAC, federally qualified community health center. We got the
Is that the
best,
health department?
not the health department. No, federally qualified community health center, they're designated by the federal government. They're one that cover the whole state of Mississippi. When you go to our website, getcoveredms.gov, getcoveredms.org, getcoveredms.org, you download a list of all our sisters and also a phone number for every federally qualified community health center, state of Mississippi. Great coverage, great doctors, great nurse practitioners, great nurses. My mom goes to one, and I love my mom. I want her to go to anything that's Mickey Mouse, and she goes and take care of it. So if you fall in that coverage gap and you don't have anything and you're about ready to give up, don't do it. Go to your nearest federally qualified community health center, and they will take care of you.
So is that based on the income, a sliding scale of care? How does that?
Now, you go where they're gonna see you, and they'll provide service based on sliding scale.
Okay.
And to help things out, if you got some insurance, you need to go there so they can help subsidize the folks who don't have insurance. All right, now we gotta wrap up. Look, we're wrapping up our 12 o'clock session. This OE9 telethon for the Affordable Care Act, Mid-South Churches, the faith-based community, here at our headquarters here in Hernando, all his crowd behind us and whatnot.
Come by and see us, give us a call.
662-298-3584. All right, at 3 o'clock, we'll be back again for part 3 of this. And again, at 6 o'clock, the same link, and we're gonna be excited. All right, thank you. This is Mid-South Churches. Y'all take care.
Yes, sir.
All right, let's go in now.